ACON is a community-based organization that works in HIV prevention and support. We are also New South Wales' largest LGBTI health promotion organization. LGBTI standing for lesbian, gay, bisexual, transgender, and intersex. When I heard about this new way of sort of using health impact assessment with, combined with the concept of well-being, I thought, there would be, great potential to see some interesting analysis from the implementation of this tool. We chose to measure the impact of the issue of relocation of older LGBT people in New South Wales from inner city areas to suburban, regional, or rural areas. There's groups that are being forced out of inner city areas due to financial pressure and the limited availability of affordable housing in inner city areas. So this process of relocation is especially difficult for some older members of our community who've experienced years and years of stigma and discrimination, and who perhaps grew up in a time where being gay was illegal, and as a result, moving from neighborhoods in which they've been able to, develop safety and community is often quite traumatizing. So we brought together a range of stakeholders for the community consultation. It was a diverse group. We invited community members that we felt were sort of at risk or potentially thinking of relocating, and then community members who had experienced relocation themselves. We also invited key ACON staff that worked on projects that sort of intersect with the aging issue, and key stakeholders and decision makers from partner organizations. So we brought them all together and followed the instruction of the MWIA sort of methodology, and engaged in this process of discussion about what well-being means to them. We also asked them what relocation meant to them, and that was really rich because the diversity of understanding in terms of the concept of well-being and the meaning of what well-being is was quite wide, as was their conceptualization of the issue of relocation. So some of the most valuable information that was shared with us was the fact that a lot of people have experienced relocation in a positive way and have been able to move and establish new social networks and find inclusive service providers. It's about learning from the people who've experienced this transition in a positive way to help better support and build the resilience of people who may be forced to relocate. The team that was trained will come away with a better understanding of the Mental Wellbeing Impact Assessment process, which is modeled after the Health Impact Assessment process and has a lot of useful sort of analysis steps and a methodology that I think can be used in a lot of different health areas. So I think there's definite sort of cross-pollination possible in terms of the skills and the tools that you develop. I think everyone also comes away with a much richer understanding of what well-being means and what it can mean and what it can encompass. Yeah.